young people there. He says that because social media can have young people there. Why young people there couldn't be group at all?
A victim of stigma, Maurice Kuruma shares his experience dealing with a protracted foot injury. A feeling of isolation turned him into a pariah. Seeking treatment was the last thing in his mind. Campaigners say stigma and discrimination are a major driver of the suffering of people dealing with mental health issues in Sierra Leone.
Stigma is one of the worst of our when it comes to responding to mental health. People experiencing homelessness because for them, it's the biggest challenge they are facing as a result of people being labeling them and just not just labeling them, but also can lead to discriminating them. So, for instance, people as long as you have severe mental illness, you are being categorized as case man, as quote unquote. So no sooner as you have that labeling, you have also again facing difficulties in terms of accessing services.
Social Workers Sierra Leone, or SWSL, an association of volunteer social workers, helped raise the money for Maurice's treatment. The organization has launched a campaign against mental health stigma. The initiative was unveiled in early February at a forum on the role of social workers in mental health settings.
This is intentionally to position social workers into mental health practice settings. Yeah, of course, over the years we have dealing with our psychosocial response have some aspect of mental health, but this particular one is an intentional one to bring in one the social work image into the mental health practice settings, wherein we want to engage government to take social work very seriously and incorporate them into whatever systems they are creating for mental health.
Sierra Leone's recent history is replete with events that have exposed the population to a lot of mental health issues. The country has since gone through a series of other emergencies with devastating impact on the economic and social well-being of affected people, from the 2014-2016 West African Ebola epidemic to recurrent floodings and occasional mudslides, as well as the COVID-19 pandemic. Sierra Leone is home to one of Africa's oldest mental health treatment facilities. Yet, it has one of the poorest mental health care systems on the continent. Campaigners say the 1902 Lunacy Act is outdated and falls far short of addressing modern day mental health issues. This was among issues discussed at this forum, which brought together experts and government officials.
Until we see ourselves as part of the whole and not the whole in all we do, we will miss it big time. Social workers, we are not the start all and end all. But let's understand where we fit in the puzzle and don't wait for wrong stones to be placed in that puzzle. We did not wait for people to call us, we called ourselves.
US based Sierra Leonean mental health counselor Victoria Cole founded the organization of this forum.
Why don't we want to talk about mental health? Because in most cultures it's a taboo. But we must talk about mental health. Maybe you've seen recent social news that untreated mental health issues have resulted with us losing some of our fellow brothers and sisters. Sad. Currently, I have a mental health practice that focuses on assisting persons who are managing mental health issues. I also educate people on stopping mental health stigma. What is stigma? In simple terms, it's thinking negative about something. Somebody might say, oh, I think negative about this brown blouse way. I think negative about woman, they put in ear short. It's a negative thought about something. And you have that negative thought. Is it true? It might be true to you, but it might not be true to the other person. In most cases, if someone thinks negative about something, they stay away from it.
People living with abnormal conditions face all sorts of challenges with implications on their mental health. It gets worse for those with mental health issues. Hamid Mo Kamara almost dropped out of school due to fear of constant provocation from his peers.
There are things that I had to deal with on a daily basis. Being that I was born an albino or a person living with albino in Sierra. So basically, while I was schooling, I came across one of the worst stigmatization I've ever faced. So going to school was a nightmare.
But there has been some progress in the government's response to mental health in the last 10 years. A dedicated Directorate of Non-Communicable Diseases and Mental Health was established. The first National Mental Health Policy and Strategic Plan was developed in 2012. Many government health facilities across the country now provide basic mental health services. Officials say consultations are underway to review the Lunacy Act. However, campaigners say a crucial missing ingredient in the whole effort is psychosocial support. Kuroma founded SWSL with the goal of promoting social work in a country where the profession receives little attention. The organization provides psychosocial counseling for individuals and communities in distress. It runs the only free food supply for homeless people in the country, the Sunday Feeding Program, which caters mainly for people living with mental disorders. SWSL also helps link those in need of professional attention to relevant service providers.
A lot of incidences have happened with regards to stigma and discrimination, but there's one particular one that actually comes from a government institution. Yeah, which is very much surprising and shocking because as a government institution, it's supposed to be serviceable to every citizen. And on one fateful day, we encounter one chronic mental illness individual who also suffering from a chronic physical health, which has to do with cold, severe cold, and other health complications, which later actually needed to be taken to hospital. So, of course, the stigma around these people, normal people don't want to transact or engage with them. So we find it very difficult to have a vehicle to actually, accompany this young man to the hospital. So what we did is to actually approach the health ministry, especially at the main government hospital, which is Connaught, to seek for an ambulance, and then we went through all the process. We paid the money, even though it's supposed to be free according to the policies for people experiencing mental illness, people with disabilities supposed to have access to free medical treatment. Yeah, but unfortunately, this individual, we have to pay for the services, not knowing the actual condition from these authorities. And when they actually now came to realize that it is for somebody who has a chronic mental illness, then they said very clearly they are not in the position to actually, they don't have that responsibility to just fall on them. It fall under the mandate of the city council. So they don't deal with destitute. That's the exact word, we had from the management of the ambulance, the driver and all of that. So that particular action from the government it's a government institution, was completely shocking for us. We have to delay the whole process till midnight to find a commercial transport. And that also again, we have to pay people to actually hold on to the young man and get him fresh, put him like a normal person. And then at 12 midnight, we took him to the psychiatric hospital. So a lot we have encountered in dealing with these people.
A Social Work Regulatory Council bill was discussed in Cabinet in February. That is the last stage before it gets to Parliament for enactment.
As a ministry, we want to give social work the momentum it deserves. Many a times, they look at social workers as a species that you go to college, you are not doing anything good, it's just social. Social work is just something for those that cannot make it, those that cannot do the sciences, the engineering, the law. But social work is very, very important in all spheres. You go to the hospitals, we are needed there. You go to the schools, you go to communities, you go to various settings, we are there. And now we are talking about mental health. So I want to inform you today that we are going to change that perception of our social workers as a means of health.
Nobody knows the wish for being affected by mental health issues. Nobody knows the wish now. Of course, as social workers and other practitioners, the empathy model is very, very critical for you. So going back to your question, how we will address this issue? It's about collaboration, it's about working together.